Hello, my name is Fotopoulos, and today I will be discussing my PCOT practice change presentation, which goes over magnesium sulfate as a primary treatment for childhood asthma exacerbation. This is the outline for how the presentation will flow. It begins with an introduction of myself and why I care about this practice problem. I will then discuss the significance of the practice problem. I'll then discuss the PCOT question that I formed in relation to the practice problem. Then I will go over the search strategies which I used to answer my PCOT question. The evidence that I found in the search strategies will then be discussed, and then I will discuss how I implemented that evidence into a change model to implement the practice change. I'll then go over the data-based evaluation and collection phases of the implementation of the practice change. Then I'll discuss the dissemination of the practice change over further venues, and then I will go over the conclusion of the presentation. So to begin, we have our introduction. So I'm a registered nurse and I have 4 years of experience in pediatric critical care. I hold a Bachelor of Science in Nursing degree, and I'm currently seeking out my Master of Science in Nursing degree with a specialization in family nurse practitioner at the University of St. Augustine for Health Sciences. I'm interested in this topic because my background is in pediatric critical care, and one of the most common presentations I see in patients that are admitted to my pediatric intensive care unit is due to asthma exacerbation. Asthma is a very common, in fact, it's the most common chronic disease of childhood, and it impacts over 6 million children in the United States. Asthma is a disease that causes inflammation in the airways of the lungs. So the significance of this practice problem includes the following information. 1 in 6, that's the number of children in the United States that are diagnosed with asthma that visit emergency rooms each year because of an asthma-related problem. 1 in 20, the number of United States children with asthma who are admitted to the hospital due to complications from their asthma. Pediatric asthma is the #1 reason for pediatric emergency room visits each year, and it's one of the top 3 contributors to pediatric hospital admissions. It's estimated that the United States spends approximately $9.3 billion each year on healthcare costs related to pediatric asthma. Some of the current management of pediatric asthma includes oxygen therapy, continuous short-acting beta-2 agonists such as albuterol, and the administration of systemic corticosteroids. Given the previous information on the previous slide involving some of the facts about asthma in the United States, it's not estimated that these practices are always 100% effective at resulting in children not being admitted to the hospital. Currently, magnesium sulfate is only listed as an adjunct therapy to be used for children that are experiencing an asthma exacerbation. So given the previous information and this information, I then decided to form my PCOT question, which reads, in children experiencing an asthma exacerbation, what is the effect of the administration of magnesium sulfate on respiratory symptoms compared with children experiencing an asthma exacerbation who did not receive magnesium sulfate? I did not include time in my presentation because I did not want to limit the types of magnesium sulfate that were used, such as inhaled magnesium sulfate or intravenous magnesium sulfate. Therefore, I did not want to include the time in my PCOT question. So to answer my PCOT question, I had to begin by searching for information on my PCOT question. The 2 search engines that I started with was the USA Search Platform and Google Scholar. After searching both of these platforms, the databases that I gathered my information from included CinAll Complete, Gale, Science Direct, and Medline. At first, the one exclusion criteria I included was the year, which would include 2015 to 2020. And then I included the key phrases, including magnesium sulfate and asthma exacerbation, as well as in children. And I also, throughout my search, I used the Boolean terms and or. Initially, I had 229 non-duplicate citations from both of these search platforms, based on simply the key phrases and the search year limitations. I then realized that there was a lot of articles that I needed to go through, and I decided to go through and I excluded a total of 174 articles after I went through the titles and the abstract screenings. I then decided to include further inclusion criteria, which included the articles needed to be full text, peer-reviewed, and further inclusion words including PICU, emergency, or hospital, as well as children or adolescents or youth or child or teenagers. After applying that inclusion criteria, I then found myself with 55 articles. I then decided to include further exclusion criteria, which included adults, anesthesia, and ketamine. I made sure that those words were not included in any of the articles I searched. That led me with a total of 10 articles, and then after further data extraction, I then found myself with 5 articles to include in the evidence, to review for evidence to answer my practice PPT question. The evidence that I found from my 5 articles came from 2 systematic reviews and 3 primary research studies. There was 4 main ideas that were present throughout all 5 of my research and systematic reviews. The first main idea included the use of magnesium sulfate alone. That was either inhaled or through the intravenous route, and that was present in 3 of my articles. Second was the use of magnesium sulfate with a short-acting beta-2 agonist, and that was present in 2 of the articles. One of the outcomes found throughout the articles was the outcome focused on improved lung function, which was prevalent in 3 of the articles. And lastly, the last outcome, which was focused on decreasing the length of stay and hospital admissions, which was found in also 2 of the articles. After reviewing these articles and synthesizing the main ideas and the information in them, I came out with two main results from all 5 of the articles. The first is that IV magnesium sulfate administration showed to have significant improvements in lung function of children who were suffering from an asthma exacerbation. And IV magnesium sulfate also significantly decreased the number of hospital admissions that were resulted due to asthma. The second assumption that was made was that IV or inhaled magnesium sulfate used with a short-acting beta-2 agonist significantly improved the lung function in children suffering from an asthma exacerbation when compared to each of these treatments being used alone. Given all of this information that I gathered from the 5 articles that I used, I decided that IV magnesium sulfate would be the best way to implement the change project that I'm working on. Inhaled magnesium sulfate does have some positive aspects in retrospect in the review. However, IV magnesium sulfate was much more successful at improving lung function, and that is why I wanted to focus simply on IV magnesium sulfate when implementing my change into practice. So now that I had my information and from the evidence that I gathered, I now had to decide how I would implement my change. This is where I will discuss the change process. The change setting, I chose to implement my change in the emergency department, especially emergency departments that treat children frequently. I decided on the emergency department because when children have an asthma exacerbation, this is the first place that they're likely to stop before getting admitted to the hospital. The stakeholders that I think will be the most important in implementing my change would be emergency department and pediatric inpatient department physicians, nursing supervisors, and charge nurses. I chose the diffusion of innovations model to implement my change, which is a 5-step model that includes the following steps: knowledge, persuasion, decision, implementation, and confirmation. The first step would involve knowledge, which would include my stakeholders becoming aware of my change. I would make them aware of my change by having a small presentation to include the stakeholders that I mentioned above, which I would present the importance of the change and how the evidence of implementing the change, and then how this could help impact our hospital. I would then, as I discussed that, would move to the persuasion stage, where my stakeholders would form an opinion of the change. Ideally, they would form a positive opinion, which would help me to move to my decision stage, which would include myself and my stakeholders engaging in activation of the change. Lastly, we would move to the implementation stage, which is where the change would be put into practice. And then the last step of the change would involve confirmation. This is where the change results would be evaluated after we have implemented the practice change. The data-based Collection and evaluation phases are described below. To begin collection, that would involve knowing what outcome we're going to measure, and that would be the lung function prior to, during, and following magnesium sulfate administration. The data that would be measured through this outcome would be ratio and ordinal data. The ratio data would include the respiratory rate and pulse oximeter saturation. These are both known as ratio data because they have an absolute zero and the increments between these values are meaningful. Ordinal data would include lung sounds and work of breathing. This is ordinal data because it does not have an absolute zero. The data collection would be performed through a chart review. The chart review would include the design of the study, which would be the design of the implementation, which would include measurement of the data before, after, and during treatment. As mentioned, the data that would be included would be the respiratory rate, the pulse oximeter saturation, the lung sounds, and work of breathing, again, prior to, during, and after the treatment of intravenous magnesium sulfate. The time of collection would be during the patient's emergency department visit, and ideally this would be done during the fall months. The fall months are typically the worst for asthma exacerbation as children are going back to school, where they are once again spreading germs to each other, and viruses and infections are one of the many reasons why that cause asthma exacerbation. Nurses in the emergency department would be responsible for the collection of the data. As I mentioned, they would be monitoring the patient prior to, during, and after the intervention of administering the magnesium sulfate. Therefore, they would be able to chart all of this right in their typical normal charting. After the data is collected, there would be a team of chart reviewers that would review the data, which would then be included in the result analysis. So how are we going to evaluate this data? So the data that we have is the dependent outcome variables would be respiratory rate, pulse oximeter saturation, work of breathing, and lung sounds. Again, this is ratio and ordinal data, and in order to analyze ratio and ordinal data, we have a couple tests that we can do to help analyze it. Because this is a before and after study, it involves two groups with the same sample. Therefore, we'd want to use either the paired t-test or the Wilcoxon signed rank test to analyze if the data is significant. After I had the results from my study, I would then want to move, and of course, if they were positive, and I assume that they would be, I would move to the dissemination phase. I would start obviously at my hospital, which would be institutional, which is Madigan Army Medical Center. I already discussed how I would implement my change practice at that location, and from there I would then move to the local venue, which would be a local children's hospital known as Mary Bridge Children's Hospital. I would be able to go there and present my presentation, which would involve the importance of the practice change, how the change would be implemented, and of course the results that we have already seen at my hospital when implementing the practice change. I would then choose regionally to go to one of the larger children's hospitals in my region, which would be Seattle Children's Hospital. I would again present my presentation focusing on the importance of the change, how it could impact results at their hospital, given the results from the local children's hospital, and then of course my institutional hospital. If I wanted to present this nationally, I would choose to present it at the Advanced Pediatric Emergency Medicine Assembly, which is one of the most well-known conferences for pediatric emergency medical professionals. This would be the most ideal place because I would ideally be implementing my practice change in emergency departments across the nation. Therefore, this venue would be perfect to reach out to a large amount of those emergency pediatric physicians, nurses, and other medical professionals. As for publication, if I were to publish the results of this quality improvement study, I would like to ideally publish it in the Pediatrics Journal, which is the peer-reviewed journal for the American Academy of Pediatrics. As I mentioned, they do include quality reports, and this would be a great one because it focuses on one of the most common pediatric diseases of childhood asthma. The practice recommendation that I would make following all of the information and evidence I've gathered throughout this entire process would be intravenous magnesium sulfate should be used in addition to primary treatment modalities for pediatric asthma exacerbation. Okay, and now I will just go over everything I went over in my PowerPoint presentation. So I've initially started and I introduced the problem of asthma exacerbation, include asthma exacerbation in the pediatric population and how magnesium sulfate may be able to help with that. I went over my PCOT question that involved the use of magnesium sulfate for pediatric asthma exacerbation and whether or not that would have an improvement in an improved outcome on respiratory symptoms. I went over the search strategy I used to gather the evidence that I gathered, and then I went through the change model, which was the diffusion of interventions. I then discussed the data collection and the data evaluation of the information that we gathered, and then I went through the dissemination of how I would locally and nationally, as well as the fan news and the publication journal that I would go through to publish my study. And lastly, I went over the practice recommendation where I would include magnesium sulfate as a primary treatment modality in addition to the current primary treatment modalities used for pediatric asthma exacerbation. These are a list of the references I used throughout the presentation. This slide here, and then I also have this slide. And lastly, if there are any questions, please don't hesitate to let me know. Thank you so much.